This is Nan McKay, and I would like to introduce you today to Marcia Blum. So welcome, Marcia.
Thank you. I appreciate you having me.
Marcia, tell us a little of your upbringing in Omaha and how this background, family, church, schools and colleges, friends and mentors, helped you decide on your life choices.
Well, I feel I had a very fortunate and good background. I was born and, like you said, spent most of my life in Omaha. I had two loving parents in a stable home and was the middle of three children. My father was from a rural community, a farming community, and he was a strong provider, hard worker, kind of my hero, so to speak. And he loved nature. He took us on trips every summer to national parks, instilled in me a respect for nature, a love for nature and gardening. My mother was from a large Polish family, and so that gave a lot of laughter and hugs and extended family gatherings. And I was sent to a Catholic grade school and Catholic high school. Surprisingly enough, I felt that the education in high school really encouraged critical thinking and to question rather than just accept facts. And I think that was partly influential into how I have proceeded. But during those time periods, as thankfully I had this stable environment, there was the Vietnam War, there were the assassinations of Kennedy when I was in grade school in a Catholic school, Martin Luther King, Bobby Kennedy, Malcolm X, all of these, along with the social revolutions for women's lib and changing roles. So that was a very unstabling in not necessarily a negative way, but an impetus for change. So I, with that, decided that I would go to college and eventually go to law school. So I went for a couple years to university and then took some time off and took a job at a psychiatric institute, which in some way led to my career from there. And then I went up to Oregon and took almost exclusively psych classes and came back and finished my my undergrad degree here and decided that I would go and become a paralegal. And I did that and became extremely disillusioned from what I saw that law did from my viewpoint. I felt it was about justice and truth, and to me it seemed that it was about finding the loopholes and working in, and which it is, for your own client. But that was a different type of justice than what I was seeking. So I went back and got my master's in social work. And it gave me a broad range of opportunities, from working individually with clients or working on a macro level of administration, policy issues, and all. So I felt it gave me a good, strong background. So that's kind of the family to how I got to my social work career.
What do you feel you achieved in the adoption field that you feel most proud of?
Well, I have to say that I have not had a job I didn't love. But with that being said, adoption was my first position as a supervisory capacity. And so I was given more freedoms to make changes. Coming into adoption, I had actually dealt with infertility myself. So I had an understanding of what adoptive parents went through to some extent. And I learned about the adoption triad. And that is the adoptee who may or may not have information about the history and past. The birth parents who had made a decision to place a child, and the adoptive parents who had typically, due to infertility, chosen adoption. These members all had issues to deal with grief and loss, unfairness of things in life, and I really developed an understanding of how to process and help people acknowledge how grief affected them, and develop counseling that was a very, very important part of the services to all those triad members. But we felt that by providing more information to that birth parent about where that child would be placed, giving them the ability to actually choose the family that that child would be placed with, and having some degree, based upon both families, of ongoing contact, would reassure the birth parent, would give the adoptive parent information as needed, and would help the adoptee have access to information and contact as needed through life. So I felt very strongly about open adoption. Sometimes when you feel strongly, the other options, you kind of fight against. And at this point in my life, I feel like there's different options that may be right for different people based on different circumstances. But I was a strong promoter of open adoption. And we when the parents came, we did all our training and home study and group training to prepare them for open adoptions. They would make a book to show to the prospective birth parents. Birth parents were giving a lot of counseling. The decision had to be their decision, not pushed by anybody. And during that time period, we got a 3-year grant from the Office of Adolescent Pregnancy Prevention, Health and Human Services, and we developed a program called REACH, the acronym for Really Explore Adoption as a Choice. And we were trying to let young pregnant women know that there was that option of adoption and that open adoption was a possibility. And so we worked with a researcher from the university here and ran that program for 3 years, being able to go into the schools, working with Planned Parenthood, working with different community organizations to get this information and work with the women. I think 2 takeaways from that program, and by the way, it was successful enough that we were granted a 2-year extension. So we ended up with 5 years of research on this. And my takeaway is that success was not based on how many young people made an adoption plan. The success was how many parents had a parenting plan in place at the time of birth. So someone who was given information and counseling, if they decided that they wanted to parent that child, we would help them. Who will support you? Where will you live? Who are resources? And get them connected with that so that child had a good plan. If they did adoption, we wanted them to be part and parcel of that plan and have that in place. And there was always the opportunity that at any time they could change their mind. So that was the first takeaway. The second takeaway was more involvement by birth fathers. As we were out in the schools and all, we were not only educating the mothers, we were educating the fathers about this. And birth fathers had been pretty much left out unless, if they happened to be involved, we would get their signature. We made active outreach and explained to the birth mother why it was important to have him involved, as well as parents or family members who may be involved in this decision. So that impacted the adoption program I was working on. And then it also impacted search. We had people in the search program come back, oftentimes it was initially for medical background that they might not have gotten about themselves through their adoption. But often it was more than that. And I'll give one example of an adoptee who came back to our program. This was a man who had grown up in a wonderful adoptive family, was adopted about 1.5 years, 2 years of age, and had a good life, but always had this missing piece. Here's my identity, and there's something that's not, that part of the puzzle wasn't filled in. But due to a fear of being disloyal to his adoptive parents, waited until they had died to come and seek any information. And that was not uncommon. So we had him go through the counseling that we give. You don't know what you're going to expect. Be prepared for rejection. Be prepared that person may, be in jail or dead. And then be prepared for limited information or the fact that they've never told anybody. So communication, so we made an outreach. We're able to track down and find where his birth mother was, get her permission eventually to share some information, and all correspondence was non-identifying through the agency. And that went on, and we do that very slowly. Everyone wants to be ready to rush and start seeing each other or talking, and we try to, through counseling, hold back to reduce those problems. And eventually, this gentleman did go and meet the birth mother who had since married, and he learned that she was living and caring for him and got pregnant again. And the man told her he would marry her only if she did not take that child. And back then there was not WIC, there were not the support systems available. Her family was not supportive of her. So she had to make that very difficult decision. How can I care for 2 children on my own? So she did place him for adoption. He learned that story. And also by spending time with the family, learned that there was an alcoholic father, and he remained very grateful for the family that he was raised in, but excited to see someone that looked like him and had mannerisms like him. And there's almost this honeymoon period that adoptees go through when they meet and see someone that they connect with at a different level. But the birth mother was unwilling, and it may be because she didn't know, it may be she was trying to protect, to give who the birth father was. And so that still left a little missing piece in that identity of this person. And years went by, and not until this individual did a 23andMe did he learn that he is 50% Jewish. And this led him to be able to go back to the small rural town where he was conceived, and it became fairly easy to determine who was the possible Jewish person, and has since gone and met relatives, and the father would be deceased at this time, but there were other people that has connected. So that is one search story, and you find all levels of this on that level, on that side. And then with an open adoption, they're families that I've kept in touch with over the years. And the Tri-Faith Church, one of the music people is a child who was placed through open adoption with our program. We worked with the family, and he has continued to have a relationship with his birth mother, who is now married, who now has 2 children. They visit on holidays, they get together on birthdays. And last year I attended a 90th birthday of the adoptive mother's mother. And he was there, and with his birth mother and her family, and the two half siblings, and they were playing with them, and they just adored their big brother. And so it showed how in good situations things could work out. And the adoptive parents had no regrets. They felt that they had gained family through this experience.
Let's talk a little bit about that age, in a sense of decade, 60s and even the 70s. You just didn't have many choices if you were a young woman, unmarried, who got pregnant, did you?
Absolutely. There was much shame. Many people were sent away to be with relatives or to be somewhere for the summer and would come back, and nothing was ever said. No one knew. It was a secret that had to be held. And those who did choose to parent did not have a whole lot of supports unless their family came through. And there's also some cultural differences here. More so within the Black community, people would step up, and a grandmother or a mother or an aunt or someone might parent. We did develop, when I worked in the adoption program, it was entitled Black Homes for Black Children. And that was from the Black community, who felt that it would be more difficult for even well-meaning white family to raise a Black child, as we can be aware of in our society today. So we did develop that program and did specific recruitment for families who would be willing and able to adopt a child. So there were many parts of this. I think that led for some young children to feel better about making an adoption placement, knowing that they would be in their culture and in their community.
And for many women back then, abortion was not even an option unless you did a very back street, off the record, back alley type abortion, in the sense that it was not legal back then.
Very, very true. We have heard stories of those who would have taken that option, or people who had and had not good results. It scarred people deeply in many ways. And interestingly enough, the agency I worked with, next to our agency was a clinic that provided abortions, and catty-cornered from us was Planned Parenthood. And so it's interesting how people could go between agencies based on their needs or decisions. You know, when you think you've heard every story that can happen after years and years of working in a field, I had a couple come into me, and they were like shell-shocked, and they had just been over and had after having had an abortion, went for a follow-up check, and she wasn't feeling well, and found out that they had aborted one of a twin, and they did not know that there were twins, and so there was still a live fetus, and they had to determine all over again what would they do. And I remember working with that couple. It was yeah, anything that can happen happens.
What did they finally do?
They chose to parent that child.
Interesting. And then that child also has carried with them the fact that their twin was not, yeah, that's hard.
Absolutely.
And you know, back then, people today might say, well, why didn't they just take the pill? Or why didn't they use, but birth control was not what it is today in any way, shape, or form. In fact, I think the pill, and a lot of our people on Trailblazers Impact have said the pill probably made more difference to working women than anything else, because you had very few other choices in birth control until you had the pill.
Right. And many of the women we worked with after this, dealing with this pregnancy, did choose to use some type of control that they may not have been aware of or had access to, and that we would be able to refer where they could get that.
What do you consider some of the frustrations and failings in the adoption field back then or today?
You know, I think the biggest frustration I have is the stigma that is put on a woman or a couple who chooses an adoption plan. There's that sense that, oh, they gave their child away. And it is one of the most selfless, loving decisions that these women think through. It's a torturous, difficult decision, but they do it out of love, that what they want for this child at this point in their life, they cannot offer. And so they are willing to entrust someone else who can do this for their child. So that just sticks with me, that there's still that negative feeling. I don't think birth parents can, even to this day, openly talk about having placed a child for adoption.
I appreciate that. You then moved on to the field of hospice work. So how did that fit in with your life goals? And tell me how you ended up there.
I will, and I went from working in adoption to hospice, then I went back to international adoption, and then back to hospice. So I had, in my master's level classes, taken a class on death and dying by a woman who had studied over in England and knew about hospice, and Elizabeth Kubler-Ross. Back then it was fairly new. And there was something that attracted me to helping people prepare for this sacred journey, which was end of life. And I learned that there was a program being offered in Omaha through one of our hospitals. And again, this was the newer startup of hospice. And I talked to the director and was hired to take that job. She graciously let me end my adoption job when my children ended school, give me the summer off, and I started when they went back to school. There was no real preparation for this. There were nurses there. I was the only social worker, and then there was a part-time chaplain. And I will say that it was a baptism by fire, because the first night I was on the job, a nurse called me to deal with a suicidal patient. And I got called out. This was a time when AIDS was starting to become more and more rampant. And this was a gentleman who was an AIDS patient. His family had disowned him, finding out he was gay. And his partner had recently left him because he had experienced too many deaths and just could not be there for him at that time. So this person felt helpless, and I just remember there was an acronym, HOPE, and HOPE to me stands for having options present every day. It's people turn suicidal if they feel they have no options. So we talked about what were some of his concerns, what were his needs, and laid out some options that we could work with. Get him connected with the Nebraska AIDS Project, get a volunteer there, find places that if he needed more care, he could move to, and helped him sort out how he could still continue to live with support and with dignity until the end of life. But that was an initial, boom, you are rare, dealing with death head on. I learned so much from my years in hospice. I learned that the best preparation for death is to live a full life. I learned that, as with, I guess, anything, every situation is unique. You can't pigeonhole people. And the beauty of having an interdisciplinary team to address the holistic issues of this patient and family, I've carried with me from that point on with everything I do. You get the nurses who ensure the physical comfort, and the CNAs who will help care. And I deal with psychosocial issues. And that could be, I mean, that's such a range. I always wanted to know, what are your biggest fears or concerns? And once those were identified, again, we can work with those. Oftentimes it was a fear of pain. And we could almost assure people that pain could be controlled, and that there was not a limit on hospice of fear of being addicted. That a fear of what dying is like, not knowing, and giving them information about typically how the body changes and what to expect and how we will support them. There was a fear of finances and how their family would do once they were gone. So there was general fears that we were able to address. And those were kind of universally, I tried to do that. And then there were those like with an estrangement issue. And I would encourage that person to give me information if they would, and I would try to locate whoever they were estranged with, and I could make an outreach for them, or that person could write a letter, or I could help them write a letter of what they wanted to say. There were several people that wrote books that were especially helpful that I think would still be helpful, but one was Midwives to the Dying. And since I had just come from a lot of midwife and birthing with adoption, this just resonated with me, that we are helping midwife and birth people from this life to something else. And so there's a whole period of kind of labor and change and transition and all. Another book that was very useful was Final Gifts by Maggie Callahan. And she was a hospice nurse who wrote little chapters of different stories. And what she really helps people learn is the communication of the dying. That there is really things that may seem like, oh, they're on some medication and they're hallucinating, or you know, something is they're getting a little bit of dementia at the end. But people would talk about needing to get affairs in order, needing to get a bus ticket, needing to organize something, seeing deceased relatives, seeing angel guides. There were a lot of this, which was, we found was not unusual as people transition closer towards death, and to help families understand that and to affirm to the patient that that is part of what you might experience in the dying was helpful. And I had families who came, because I grew up in Omaha, I served people who I knew at different times. If they were agreeable to that, it was always their option. And one family said, that they had read the book and knew and wanted me to come over because their mother was touching her face and smiling, and they were asking her, and she said, oh, the angels are giving me kisses. And you know, she would talk about what she saw. And so there's a sacredness and a beauty to that time of life, not to dismiss all the losses and the loss of dignity, and how to address that, to be treated with dignity when those things happened. Ira Byock was kind of a guru hospice physician, and he wrote a book probably back in the 80s or 90s called Dying Well. And he identified 4 things that he thinks everyone should say at end of life. And these were, I forgive you, please forgive me, thank you, and I love you. And I would work with people. One of those comments alone could lead to a whole lot of resolution or talking or reaching out. And I think that's important for all of us to keep in mind and say regularly through life. But, love and forgiveness kind of are core issues. And for someone to have a peaceful end of life, those could help with some resolution. So those were, and then I did help get a hospice house started in Omaha, because dying in a hospital is very different than dying at a facility that is set up to welcome and normalize death, have nurses on hand, volunteers baking cookies, families able to be there all the time, someone who comes to play the harp, animals welcome, garden. It turned out to be a wonderful facility, and I hope every community has those. During my hospice period, I started a group called MON. And since I was the only social worker, I wanted more interaction from people in my field. So I invited all the chaplains and social workers from every agency in the metro area to meet once a month and share information, share books, share, if you've been to a conference, what you've learned. We could do non-identifying case reviews so that people could give feedback or resources. And it happened that we were able to meet at the Centering Corporation, which is a national grief resource center. And so there were a lot of books and resources there. And through being there, Joy and Marv Johnson, and I would say Joy Johnson is one of my mentors in life. She wrote books on grief, on children's grief, and went out to 9/11. She went down to Oklahoma. They went and provided support to people. And so she was a wonderful person to have at our meetings. And along with her, we identified a need that was lacking in Omaha, which was no grief resources for children. Occasionally a church would have a support group, or Children's Hospital might run one, but nothing that fit with the ongoing needs. So we started by running a kids camp, which we did one day in the summer, and anyone could invite, and we would do activities, and we would name names, and we would have the parents in one group and the kids in another group, and a butterfly release. And then we did a tinsel and tears over the holidays and did some activities. And it was to allow people to feel, and instead of forget that person, to remember and honor that person, which led in, I think it was 2001, me and, I think there were 7 other people, and I incorporated into Ted E. Bear Hollow, a grief resource center, all volunteer for several years till we were able to get grants and an executive director. But we knew, after I visited the Warm Place down in Fort Worth, and someone else visited the Doogie Center, and we got curriculum ideas and all. And the Centering Corporation allowed us to use one of their old offices. And so we sent out information to funeral homes, to all the hospices, to schools, and said, if children and families need a place, every child who came had to have an adult there in a group also. So the day opened for our first group, and we didn't know if anyone would show up, and it turned out there was a line out the door. And we did this. It was all passionate professional volunteers. And now it has been in existence. It serves thousands of clients a year. Many of those who went through the program have come back to volunteer and to fundraise. We have a Comfort Classic every year, but that is one of the programs that I'm really excited that I was able to help start.
I can understand why that's dear to your heart. Tell
Yes.
me how you went then from there into getting involved in sex trafficking.
Oh,
And I
that,
don't mean you're involved in it. I mean,
that's
being the other side.
that's a, yes, that's a big leap. Um, in earlier times, I had worked with children. I had worked with children in foster care. I had worked in a group home for adjudicated teens. I had worked with some schizophrenic kids. And during the time I worked in foster care, we had some children who had been sexually abused and who had talked about being part of cult type situations, seeing ritualistic activities and all. And so, but even back then, I knew that sometimes this happened. And when it became evident through a meeting I went to at one of the churches, that sex trafficking is here and it is growing. And in fact, it is actually overtaking drug trafficking as far as the money that is being made. I needed to step up and say, what can I do and how can I be part of this? This is abuse in an awful way to children and teens. And so we just had to start with meetings that everyone who was interested came. And over that, people broke off and some got involved in trying to find services, some in starting a place to live. I got involved in a hotel motel training program where we would go to the hotels and motels and get all staff, housekeeping, front staff, anyone who was involved, but those were often the people who really saw, and educate them on what to look for, what were some of the signs, what to do, what not to do, showing them pictures of, tattoos on young women who, if they tried to run, could be identified and given back to their John. And so it opened a whole new understanding of a world I didn't know was out there, and that has grown in large part because of the internet, the dark web. And then I became part of a small group called The Force, and there were 5 women in the community. And we took it upon ourselves to educate and learn as much as we could and share that education. And we started a Facebook page for our area. And then we began working with a group called HTI. It was a human trafficking initiative through Creighton University. And they have an amazing program where they follow like phone calls and all through the web and ads, and they are able to connect the dots and see where things are going, and they work to alert the police and have helped with some major busts. And I think it's called the Omaha program right now. And so we did a fundraiser to help support that program, and they have since left Creighton and are a self-standing program working to continue to develop more and more like an AI, an automated way that this data can be used and shared with police. So that's some of the activities I've been involved in.
And how do you get children out of those situations?
It is not easy. I think the more people that are aware, the better chance we have. Educating emergency room personnel. Certainly the hospitality industry is big because that's where a lot of this is done. So finding, they go to hotels and they meet. I found it also interesting to learn that one of the busy times of day is between like 11:30 and 1:30 during the lunch hour of businessmen. And that it's peaks in our area during like the College World Series and Berkshire Hathaway days, and where there's a lot of people coming into the city. And so we hand out flyers and we have information in stalls, bathroom stalls, and people who run the streets are often victims. So we work with like youth emergency service who takes in these kids and gives them meals to get the word out there. And it's really education, awareness of people. Truck drivers have been wonderful in learning about this and identifying, because truck stops along I-80 are big places. So it's one, one person at a time. And then, you say, how do you get them out? Once you do, we've initiated laws, and I've been involved in laws that will increase prosecution for the buyers, which had been kept under $100 because it's not listed in the paper or anywhere, to bigger fines for the Johns, to having the law look at these women as victims that need support. And so there have been quite a few laws that we've gotten passed to, like, if it happens that they're found or picked up and they have been using drugs or something, that they're not held on that offense, that there's special places that they go to, and they're always allowed to have someone with them. It can either be someone from the advocacy program or someone of their choice, that they are given information to follow, how they're treated through the exam. There's just been a lot more done to support them going through the process of leaving, and then more programs that give them a place to live, not just for a month or so, but for a year or two, because many of these were young people who didn't have an education, who need to relearn skills, learn to own their identity as a worthwhile person, and go through a lot of forgiveness of self and others.
That is tremendous that, you've undertaken something like that, and you seem to take on issues and you're not afraid of anything, right?
Oh, no, well, this pandemic has kind of
Maybe gotten to you.
for a loop, but I did teach during a time period and loved working with students, and I've done a lot of work with practicum students, but I was able to teach ethics and cultural competencies. And these were not to social work students that I taught, but they were to people in the medical field. And I felt that that was helpful for them to look at themselves and be aware of their cultural biases, the golden rule. And the golden rule is not exactly do unto others as you would have them do unto you. It's knowing what is best for them, because someone who is of another faith or a totally different culture may need different responses than someone who is Catholic from the Midwest. And so I really feel it's important that we become aware of our biases, our assumptions, our privileges, and learn a deep respect for every person that you serve. Yeah, and then I started a senior solutions program, which was rural mental health, which is just another issue, but it included telehealth, and it was going to a community where people didn't have mental health problems. You just got up by the bootstrap and you just kept going. So it was working to reduce biases. I would go speak anywhere. I would go to Rotaries, Kiwanis, senior centers, doctors' offices, to let them know that we had this service available. And we led groups, which I think was important, because as these elderly people would come, they knew that they were not the only ones, and they could learn from each other. And then we had individual sessions. And one of the barriers is transportation. So we had a van, and we would go pick up people, and we would give them a snack or a meal. So it was a good program. The hospital eventually took it over. It was started by a national program, and I think that led to me eventually doing mental health one-on-one for the elderly. And I find that no matter what all the other problems are, the number one issue is loneliness.
Mm.
Yeah.
And to wind up our conversation, I just want to tell you to tell us one more thing, and that is what you've started in the tri-faith area.
Oh, that's very exciting to me. The tri-faith is an intentional community that a rabbi and an imam and a Christian pastor, and of these three faith communities, chose to purchase land and build in near one another, with the middle section being Abraham's Bridge that goes over Hell's Creek. It was named Hell's Creek before. That was the original name. And it is a way to learn about one another's faith, to share in activities together. When I traveled, I would hear the call to prayer, and it meant nothing to me. Well, one day we were able to have someone come to the church and do the call to prayer and explain to us what it meant as they were doing that. We have Earth Day activities where the three faith leaders come and, based on their religious background, share values of the what our responsibility towards Mother Earth. We have a tri-faith garden that I go and help with the garden, but it is to encourage respect and diversity, and to do that through learning and spending time together. I would encourage people to look up Tri-Faith Community and learn more about it. And I think it's the only one in the nation, if not in the world, that has been a purposeful community like that.
Well, thank you for all of your service that you have given to the community and made the community in so many ways a better place to be. And if everyone did that at the local level, we would have such a different place to live than we currently do.
Can I give one more comment?
Sure, you can.
My one thing that is important to me on a daily morning basis, and I would encourage everybody, is keep gratitude, live with gratitude. We all have blessings, whether it's that you really still have your five senses, smell, taste, touch, whether you're able to breathe well, there are always blessings. And I think what we put in our brain, what we put in our body and eat affects us. And so choose to live with gratitude.
And it sounds like every day that you get up, appreciate the day.
Absolutely. It is a gift.
Thank you so much.
Thank you, Nan. I appreciate you taking the time.